interrupt your program to bring you this important podcast. How to 911.
Can you put me out of service on a podcast, please?
Welcome back, guys.
Yep.
Fantastic. I'm Sammy.
I'm Erica.
And this is a very amazing day for us, or for you guys, because this is the 1st of April for you guys, not for us. But, and this is a bonus episode. Not only is it a bonus episode, but it is also the same day as our very first episode.
Oh, man.
It's so exciting. I'm very excited. So you get a 2-for-1 special before it even really gets started.
Yep.
That's just how great we are for you.
2-for-1?
2-for-1. No, but really there's just a lot going on in the world right now that I feel like we have to say something and not say anything.
Right.
Hopefully those double negatives work out somewhere. Also, super exciting news is that even though we've recorded other episodes besides the first episode and currently this bonus episode, we finally have gotten our email for you guys to send us your questions.
Yay.
I'm extremely excited, and it's extremely simple to remember. It's just how to 911 without the colon, so just how to 911 at cityofloveland.org, and we will also put that in the link for every single episode so you guys can find that easily. And we're in the process of also getting out an Instagram, which we will also keep you guys updated on the handle and like when that's going to post. Hopefully right after we record this episode, we're going to probably find out that it got approved and then all of this is outdated. But who knows? The world is always changing. So back onto the whole world pandemic that we're experiencing right now. Wow, I told myself I was going to stop saying so I've just replaced it with
You're getting better.
The smoothies make me a little phlegmy.
Oh, great. I mean, not great. Well, stop sipping from it.
Erica got these delicious smoothies, so
They're delicious.
she's amazing. She's my amazing partner in this podcast. Sorry, I'm a bit parched. When there is a pandemic, which is what we're going through currently, we thought it was important for us to throw out there as much information that we have available right now as to what we're doing as a community in Loveland, Colorado, what we're doing as a community in Larimer County, what we're doing as 911 dispatchers and first responders, and try to educate you on what you can do to make yourselves healthier and stay safe. Again, like I've said probably 6 times already in this episode, that everything is ever changing. Mm-hmm. So this episode is being recorded on March 27th. Our latest information is from March 25th. So if there's anything that has changed between the 27th and the 1st when this posts, I will, unfortunately it might be a little choppy, but I'm going to add in as much information as I can to this episode. If it's after it's released, we will update you guys as much as possible as it comes into us. So might be some more bonus mini bonus episodes, because this one's probably going to be the bigger chunk of it, because it's going to just umbrella it all. Fair to say. So what is this pandemic you want to ask?
I do want to ask.
I appreciate that. It is the Dos Equis virus, is that right?
Mm-hmm.
The Bud Light virus?
Yep. Both of those.
I can't remember. It's a beer, right?
I think so.
It causes the beer causes the virus?
I don't drink, so...
I don't either. That's probably why we are 911 operators, because we're so lame.
So, yeah. It's not the margarita virus.
If only. No, it's the coronavirus, which I'm sure you guys are all aware. We're going to refer to it as COVID-19, or just COVID, or the Rona. You'll just get all kinds of variations.
Yeah.
We're hip.
Sammy's hip.
Nope. So COVID-19, what is it? It's bad.
Just bad.
Not good. It's not fun, and it's causing a bit of a scare for a lot of people. A lot of other people think it's just hoopla, you know. It's crazy. So, I'm not a doctor. I didn't go to school. Dropped out of college, in fact. Don't recommend. Don't drop out of kids, folks. Wait, no. Don't drop out of school, kids. I hate my life. Don't drop out of kids. Thank God for editing.
No, this is the stuff that's staying in. Don't drop out of
I've
kids.
been awake since like 7 p.m. yesterday.
I was like, since 7 a.m.
7
p.m.
That would be 12 minutes I've been awake if it was 7 a.m.
Since yesterday, that would be 24 hours.
Oh.
So,
Whatever.
Needless to say,
don't drop out of school because you'll turn out like me. Don't want that. COVID-19, it's a viral disease?
Yeah, it's a virus.
Yeah, it's a virus. I'm not a doctor. I'm not going to go into the shindig of it all.
What we know is it's bad. It affects your respiratory system. Can't breathe. May cause pneumonia. Lungs fill with fluid.
Yeah.
Yuck.
Gross.
And that's the most extreme.
Right.
Like it could be mild.
Or you could show no symptoms at all and carry the virus.
Right. Which
is even more terrifying because you're spreading it to people that are more susceptible to such things. So our main thing is to not tell you about the doctor portion of it. We're going to tell you about the 911 portion of it, which is when to call 911, or I guess just the police department or just call us in general, non-emergent number or 911.
Yep.
Call 911 if you are having severe symptoms of COVID-19, which, again, like Erica said, it's the respiratory issues, like difficulty breathing, if you're gasping for air, if you have a fever, you can't get out of bed, you're alone, you need someone to come transfer you to the hospital, that's what we're here for. If you're showing mild symptoms, like you're breathing fine, you think you have it, you don't know what to do. Honestly, I don't know a good way to put this without being too blunt, but you can take yourself to the hospital. You can take yourself to your doctor's office because our ambulances are starting to become busier and busier with people that are having the more severe symptoms. And so in order to keep our ambulances more available for those people that do have those severe symptoms, if you are able to or have somebody there that can take you and you're not showing severe symptoms, again, like if it's mild or you think that you might have gotten it and you're not in any severe case, take yourself to the hospital, take yourself to the doctors.
And call your doctor.
Yes.
First.
Yes.
And then if you need to go and you're able to, take yourself.
Right.
Yeah. So, not to be facetious, but 911 is for emergencies. So if you feel like it's an emergency, you can't breathe, you're delirious, well, if you're delirious, then you can call 911. I don't know. But
it happens.
Yes. So most severe symptoms, or for a loved one, if you're really concerned about them and they're having that difficulty breathing, for us, that's one of the most important things where we want someone to get out to you as soon as possible. So if that's happening, please call 911. If it's not that severe, call your doctor.
Yeah. I think that's the biggest part. Also, if you feel like you have been exposed to COVID-19, you had a friend that tested positive, or you think that you were around somebody that might have had it, it's just best to tell your doctor or tell the hospital just in case, because you are raising the chance of infecting other people if it was in fact a positive case in which you were in contact with, and then not warning them and not having them wear the right equipment is just it's just not good, because now you're infecting healthcare professionals that are really just there to help, and they don't need to be exposed to it any more than they already are.
Right.
Same goes for our ambulance. We would appreciate if you would also tell us if you've been exposed, or if you were traveling somewhere that did have positive cases, such as Italy and China, But since it's becoming so much more common here in the U.S., we're really not taking the travel perspective into it. We're just thinking about, have you been in contact with anybody? I might be skipping some bullets here, but no, I'm not going to skip bullets. Never mind. We'll get to it eventually. About the ambulance thing.
Those circles. Yeah.
Yeah. So the city of Loveland, we have changed a few things, and we have especially changed a lot since the 25th. The offices, such as like utility billing records, like any public city office that you go to for whatever city business you need, they have been closed since March 18th. There's currently no end in sight, really. Even with the stay-at-home order, things can just change.
Right. It's still, like, was April 17th and then reevaluate, so...
Right, yeah. So, really, I'm just going to say they've been closed since March 18th with no end in sight. That being said, you can still call the services. You can look up their phone numbers online. I'm sure they're in the phone book. Whatever resources you have to find those phone numbers. Don't call 911, please and thank you. You can still call them. If they're working from home, you might have to leave them a message. They'll get back to you as soon as possible. You're just going to have to be patient with us because we're trying to work through how our business is still going as usual with this virus going on. So the police department is closed, meaning we're not letting anybody into the lobby. So if you have to come in to make a police report, which you shouldn't be because you should be staying at home per the stay-at-home order, but if it's after the stay-at-home order and the lobby is still closed because of whatever situations, you can always call us on our non-emergent number in order to make reports so you can stay home. But if you come into the lobby to pick up somebody who was arrested, because that happens, and we take them here and they're being released for whatever reason, and you're coming to pick them up, you're going to have to wait out in the parking lot in your vehicle. You still need to call us to let the officer know that you're here for them to be released. So you can still come into the vestibule and pick up that phone and contact that rings right into dispatch. So that's how you can contact us, but we're going to get your vehicle description and everything so that we can meet you outside. We're just trying to limit as much exposure as possible to people, basically. Do you have anything you want to add about that?
No. Except we're always open. I mean, like, you can always call.
Right. Always.
Building closed, services open.
Yes. That's a huge thing. I love when people are like, well, the police department closes at 5 or something. I was just like, yes, the police officers go to bed at 5 p.m. like everybody else.
Shut their drawers, lock up.
Yeah, no, even though police department's closed, we are still open. Everything's business as usual for us.
Yep.
So just remember that. Don't think that you can't call us anymore because of what's going on. Larimer County has made a lot of changes as well. Oh, let me go back to the city of Loveland. If you have any questions about what the regulations and exactly what everything is, I will put a link into the description to the cityofloveland.org. I believe that's the website.
That sounds right.
Yeah, it sounds right. If anything, just Google City of Loveland and it'll take you right to
Colorado.
Yeah, City of Loveland, Colorado. Larimer County, going back to them, they also have more updated information on COVID-19 in general. They're keeping track of positive cases here in Larimer County. That's always very useful. It's regularly updated. They just have so much information on their website that I thought was extremely useful. Yeah. They, especially with the stay-at-home order, they have a lot of frequently asked questions. Currently, as of like 3 o'clock this morning when I checked, there isn't anything under there because it's so new. They're still probably waiting for people to send in their questions. So if you go to larimer.org, you can find, like, at the very top, it literally says COVID-19 updates or something like that. You just click on that and it takes you right to it, and it says facts, frequently asked questions, and there's a form for you to fill out if you have a question. So that's one way that you can ask those questions that you have about the stay-at-home order. If you call the police department, we're probably going to refer you to their website or or transfer you to we have a COVID-19 hotline, because I have no idea what exactly it all
Right.
takes,
The city didn't put it out. It was
the county.
Yeah, the Larimer County. So they're the ones with the answers. We can find the answer, I'm sure, but for a definitive answer.
Right. Because
Okay.
even if you ask us, like, oh, can I go to do such and such, I'd probably be like, I would think yes.
Right.
But you should go double check anyways, because I don't want to give you the wrong information.
Right.
Because I'm not a police officer. I'm not a county employee. I did not make this stay-at-home order. So read it. I printed it out. I tried to read it, and then I had to do my job. 911 calls and all. It's pretty long, but it has some really good information, which we'll get into in a second. Which I think is right now.
That's it. It's been a second.
Well, Larimer County also, like, on the website, larimer.org, they have, like, little links to click on. Like, what you can do about COVID-19 and what does COVID-19 mean. Like, their website, I was very impressed with the information that they had on there. And there's a tab that says what to do if you're sick. There's, my goodness. I swear to God, I'm not sick. I just feel like I'm drowning, Erica.
That's pneumonia.
I'm just kidding. It's this smoothie, man. I need to stop drinking it.
You've only had like 2 sips.
I know. How are you not, like,
Because I would just
going through puberty here?
Oh, I don't know. Maybe you're ready.
Hold on. Let me take another sip and see what's going on. Yum, yum, yum. Okay. So they have a link that says what to do if you're sick. There's overview of COVID-19 and how to protect yourself from COVID-19. Basically everything that I already said before, but really, really good information there. In reference to the stay-at-home order, we're just going to tell you about a few of the major things that we think are important to share with you guys, especially with the questions that you've been calling in and asking us already at the police department on our non-emergent number. Thank you so much.
Which is 970-667-2151.
Thank you. So stay-at-home order is exactly what it sounds like. We are not. The county is asking for you, and I think the whole state, is asking for you to stay at home, just because the less that we are in human contact, the less likely it is to spread, the less likely it is to kill a lot of people, as you can see in Italy, as you can see in China, all of these devastating things that they're going through. So during the stay-at-home order, you're able to go to the pharmacy to get medication. It's an essential thing.
Yep.
Get groceries because you need to eat. You can have takeout meal from your local restaurant. Restaurants are still, as long as it's not a sit-in restaurant, I believe that they're still doing takeout. You can't sit in, but you can do takeout. You can do delivery. A lot of restaurants are changing the way they do things to form delivery because they know right now, like, unfortunately, they're kind of losing business from this, so they're trying to adapt to what's going on. So just call your favorite local restaurant. Small businesses are really suffering from this, so just call them, see what they're doing, see what you can do to help them out. I'm sure they would greatly appreciate it, and we would greatly appreciate it too, because we want to support Loveland.
Yes, definitely.
You can get food supplies for your pet because your pets need to eat. You can go for a walk or take a hike as long as you're keeping distance from others. So you can't take your family of 600 and start walking through Loveland. Yeah. Because social distancing is major. I believe if I read my email correctly last night, the parks are closed. Yes. So that's cool.
The, equipment is...
Like basketball courts.
Yeah. But you can still walk around but dog parks, is that closed? I think it was too. So you can still take your dog on a walk, just not hang out at the dog park. Yeah.
We're just trying to keep you guys away from each other, This is where introverts really thrive. So yeah, enjoy city and county spaces. You take grocery supplies to your at-risk parents, grandparents, or neighbors. This is literally in the stay-home order, and I want to read it because the county put it out there, so...
It's an official...
It's official.
Yep.
I got it from the website, guys.
Yep.
As of... what did I say earlier? It doesn't matter. You can get margaritas to go from your favorite watering hole, but please enjoy responsibly from home.
Yes.
Don't get the margarita to go and drink it on your way home.
Don't do that.
Because, our officers are still pulling traffic and they're still arresting people despite what's going on. Right. Wow. You have not stopped me from saying
I think maybe I say it so much that I'm like, that's appropriate right now.
That's appropriate. Do you want to do this next one?
Yeah, what is the next one?
Oh, the essential
activities. Okay. Mm-hmm. Let me just read over it again.
Yeah, do what I just did. Yeah, you got it.
Thanks for the encouragement. Well, it's kind of the same thing. Essential activities in business. So you can stay at home except for essential activities, which includes tasks essential to maintain health and safety, such as obtaining medicine and seeing a doctor, which is going to the pharmacy to get medication. Mm-hmm. Get necessary services or supplies for yourself or family members. So food, supplies, what else supplies? Food and supplies?
Yeah,
pots and pans?
Yeah, pots and pans. Don't get any more. You don't need toilet paper.
You don't need toilet paper.
You do not need toilet paper.
You do not need toilet paper. But your pet might need food, so you might need to get that. Caring for a family member in another household, so going to visit them. Or caring for the elderly, minors, dependents, people with disabilities or other vulnerable persons.
So basically people that I feel like you are already taking care of.
Right.
Not
new people that you're...
Right, don't go seeking out trying to find somebody to take care of, quote unquote, just because you want to get out of your house. Mm-hmm. We don't want you to expose yourself to anything, so keep yourself safe. If it's somebody that you care for already, you can go ahead and keep doing that, I guess. I'm just kidding. Also, critical business, like essential businesses, if you are an essential employee, you're going to keep working.
I mean, we're here. We are essential. We can't not come in because of this. We're here still 4 days a week.
Yeah.
Or more.
Or more, depending on if everyone starts getting sick.
Yeah.
We'll get into that later. But there's that. If you guys have questions, like I said, go to learnmore.org. Go to learnmore.org. They have all of those really cool tools that I already told you guys about. So like Erica said, we are essential. We're very important. I would like to think that we're the heartbeat of first responders. Without us, let's be frank, they can't do their jobs.
Truly.
How
will they,
Your call gets taken to us and we tell them.
Yeah.
If there wasn't us, there'd be no way for them to know what's going on from your phone calls. They can, officers can still self-initiate things and do their shindig, but...
The paramedics can't go door to door and be like, you good? You good?
Are you okay? You feel sick?
Yeah. Yeah, so they can't go and look for sick people the way officers can look for people who are violating the law.
Yeah, I'm so sorry. I just slurped. I hope that you guys didn't hear that. I just want Erica to talk, and so I'm over here she's admiring her.
I'm pretending. Admiring her.
Wow. Guys, I'm so sorry. I edit this podcast, and I hear myself say, so many times. I'm so sorry. I'm trying really hard to fix it. And it's only the first episode that you've heard. But let me tell you, there's so many more to come, and I'm so sorry. So we're very important to this. The whole process of your emergency services. So what are we doing to stay healthy? When was it? When did we have our dispatch meeting? It was like the beginning of March.
Yeah.
Yeah, it was like the beginning of March, and we before we even had any stay-at-home orders, before businesses started closing.
Before you weren't supposed to have meetings.
Yeah, before you weren't supposed to gather in large groups, we had a meeting and decided as a center we were basically locking down to even prevent any of it from starting, because, let's be honest, our firefighters, our paramedics, our police officers are out there with people that could potentially be infected. They're out there contacting people constantly with that's their job. And if they come up and bring it to us, that's not good.
Not good. And we are in such close quarters. Like, our center isn't a huge room. We, unfortunately, cannot abide by the 6 feet social distancing that we should, that other people, you should be doing.
Everybody but us.
Yes, we are exempt, not really. But we don't have that option of making sure that we're that far away from each other. So if we did get it, it kind of, and we were all susceptible, we'd be affected.
It spread fast.
Yeah. So we've decided at our dispatch meeting that we would lock down our center for, just for us. So if you're not essential to our team at the moment, you're not allowed in. If you do have to come up, like an officer will help bring up paperwork for us sometimes. And, I mean, we have to, too. Every time we walk into the center, we wash our hands. And, otherwise, you can't come in. We have, I don't even know if this is important. We have our little
It's all
germ.
important.
No, our little germ. What is it? The thing that Ben got?
Oh, it's like an air purifier.
Yeah. We got that, so our air's nice and pure.
Yeah, so pure. Also, we disinfect.
Yeah.
We usually disinfect our consoles pretty often anyways.
Because we're all touching it all the time. It's not like, this is my cubicle.
If only.
Introvert.
You're right. You know how disgusting it would be if we all touched the same mouses without... I'm glad that's the computer part that I go with, a mouse.
Well, it used to be, I mean, the keyboards, we have our own, and we didn't used to.
Right. So that's really nice. That's a good way to... But we're still touching the mouses. We're touching other things. We disinfect everything. We're having, like, our cleaning company come through every single night and do deep cleanings. So I think that's about it that covers with us. I swear to God, if I say it one more time.
That one was an
Responder safety. That's where I just love my job. I love the people that I work with. You guys are never going to hear me stop saying that. And if you do, then this podcast won't exist anymore. But they're amazing for doing what they do, especially in times like this where their safety, not only is it always the least of their concerns because their job is to put others in front of them, but it's really the least of their concern right now. But also the top of their concern.
Yeah.
Hence why we ask for you, if you think you've been exposed, to let us know so that we can protect our responders. If one of our responders gets sick, it's just like it is for the dispatch center.
Yep.
It's just a domino effect. One and one and one and one, and then we have limited ambulances, and then we have limited resources. So they're being as responsible as they can. So I know for our fire units, they are being a little bit more careful about responding to certain medical calls. They are going to still respond to medical calls, but they are now going to be staging depending on what the call circumstances are. And by staging, I mean they will basically post up on up the street a bit and wait for the med units to go inside first. So the paramedics might even cancel the fire truck depending on what's going on. They might ask for them to come in full suit. They might say, oh, they're not showing as many symptoms as they think they are. But again, symptoms don't really show. Right. It's really up to their discretion. I am not a medical care provider. I do not know exactly what they're doing, but if you have any questions, I'm sure that you can email us your questions, and we can get a hold of our Thompson Valley paramedic chief. Is that what they're called?
Yeah, captains.
Captains.
Anyone.
Yeah, we can get a hold of our Thompson Valley paramedic captains.
Yeah.
They have people in charge, and we'll get you your answer.
Yeah.
Yeah. Yeah.
It's perfect. That's why we have an email address.
Oh my gosh. God, that was so exciting, guys. I was so excited. Officers are starting to try to take more phone calls, essentially.
Yeah.
Calls by phone. Right, calls by phone. So if you call in and something, like we said in, I was going to say a previous episode, but you've only heard one, so I don't remember which episode it's in. I think it's in the second or third episode. So something to look forward to. We say that they try to take as many calls by phone as possible because the less they have to go travel somewhere means that they're more available for an emergent call, essentially. So they're trying to do that even more now. So before we would kind of make a decision if it was by phone. Now they're going to kind of push it off. So we'll try to say we'll have an officer contact you as soon as possible. I don't really know. That's what I've been doing because I don't know if they're going to actually Why am I talking? Why am I on this podcast?
Because you had a brilliant idea.
It doesn't mean I'm suited for the limelight
and
here.
Your sidekick is enjoying it.
So we don't know what they're going to do per their policies because they have to think about their safety as well. Should I mention this last bullet? Yes, I'm going to. Just because if you tell us that you've been exposed to COVID-19 or if you're showing symptoms like breathing problems or fever or what's another symptom? Coughing. I don't know. We have our policies that I don't really want to go too deep into for you guys because that's going to be another episode when we talk about our emergency medical dispatching. But basically we have symptoms that we're looking for on certain selections of what we call cards. It doesn't make any sense to you right now. Just ignore this.
Call types, yeah.
Call types, yeah. So different, depending on what you're feeling and how you're feeling, we go to certain call types and we have questioning from there. If you tell us you've been exposed, you think you've been exposed, or you're showing certain symptoms per those call types, we will advise our paramedics that, in which you might be getting a delayed response. Meaning, they're taking that extra time to put on that extra gear to make sure that they're taking care of themselves. I will tell you if that's what they're doing, and that's why they're going to get a delayed response.
Yeah.
Depending on the situation, if it's something crazy going on, I might not have time. Like a cardiac arrest event in which they were showing symptoms, I might not have time to tell you that there's going to be a delayed response because of them putting on the protective gear.
And they're still going as fast as they can.
Right.
They're still going to drive to you and hurry, and it's not that they're a delayed response in other that they're trying to protect themselves and you. So it might take an extra. Just imagine putting on a jumpsuit and mask. That's the extra little bit that it'll take them. Right.
I think it's very comparable to like when firefighters are actually going to a fire call.
Right.
Where they actually have to suit up. It takes just seconds.
Yeah.
But those seconds in an emergency feel like minutes. So just be aware of that if you do have to call 911 in an emergent situation.
That's good.
That you need this kind of thing for. I feel like I already covered it, but it's always safe to recover it. We will ask you if you've been in contact with somebody in the last 14 days. Again, it's hard because symptoms haven't shown sometimes within 14 days. So I would just much rather err on the side of caution. I don't want you to lie to me and say that you have just because for whatever reason.
Yeah.
I don't want to have to use extra resources if we don't need to, extra anything, because all of the paramedics' resources and tools and gear that they're using, it's not reusable. They have to clean out the ambulance every single time. That takes them out of service for a few minutes to clean out and disinfect everything so that they're not making the next person infected. So please don't lie just because you think that you get a better response that way. That's not how it works. But if you think, please, we're going to err on the side of caution.
Yes.
Cool.
There we go.
Now, how to keep yourselves healthy as much as possible. Listen to the stay-at-home order. Wash your hands.
Wash your hands.
Wash your hands. We should be doing this anyways. You should be washing your hands anyways.
Yeah.
This makes me so mad when people are like, we gotta wash our hands. I'm like, wow.
What were we doing before?
Yeah. What were we doing before that we did not wash our hands? Also, if, washing our hands isn't acceptable, not acceptable, accessible. I guess whatever.
Or acceptable.
Or
You're
acceptable.
someplace to like stop using the water and the soap.
Yeah. Hand sanitizer, which is hard to find at the store still, has to be 60% or higher of alcohol. Otherwise, it's not going to work, guys. What else can we do to make ourselves healthy?
Eat well.
Yeah. I'm not one to speak about eating well, though, so.
But here's the thing. Try and eat well, but if you're quarantined, slurp. If you're quarantined and you gotta eat whatever's there and it's not healthy stuff, you still need to eat. If it's a box of macaroni and cheese, which is delicious, that's what you have to eat. So what if it's not 96% lean ground beef with a spinach smoothie?
Or gluten-free, dairy-free.
Well.
Unless you have, eating...
Right, yeah.
I
saw something where a mom was saying, can people who don't have the celiac disease please stop buying the gluten-free stuff because my children do have it and they need to eat.
Yeah.
So consider that too.
I'm just going to talk very briefly about this crazy hoard shopping that we've got going on here. I totally get it. You want to be prepared because we don't know how long this is going to last. We don't know how long we're going to be staying at home, but we can still go to the grocery store.
We can go to the grocery store.
As of right now, until the foreseeable future, you can still go to the grocery store.
Yeah.
You can still get food from restaurants. You do not need to hoard something because there are people that really need that.
Mm-hmm.
There's people like me that don't plan ahead and have been waiting for weeks for this to die out, and it hasn't. And now I don't have any food.
Do you need something?
No, I'm good. I just got Monsters last night at the store, so
is that
that was my priority.
Okay, well,
and
priorities.
Coffee.
There you go. But you're right. Allergies. I mean, there are people who cannot eat eggs.
Yeah,
dairy, soy, whatever. All those allergen-free things. If we hoard them, that's not good. And I think it puts a stress on the whole system of the United States. Truck drivers have to drive more, so they're up more.
They're still working.
The grocery store workers still have to worry about stocking the shelves and worrying about people coming and clearing them out. So I think I heard someone say, shop for a week at a time. Grocery stores are still open. We don't need to panic buy.
Right. Until the zombie apocalypse happens, I think we're going to be just fine.
That's right. And even when the zombie apocalypse happens, we'll be fine because zombies eat people, not food on the shelves.
Logic 101 by Erica. I love it.
So, when you go for supply runs,
just stay away from those zombies.
Don't get eaten by a zombie.
Yep. Duh. I'd like to see you do that. Daryl.
Oh my gosh, if Norman Reedus listened to this.
Hi Norman, are you listening? I think Erica's your biggest fan right now.
You are. Also give us some tips on the zombie apocalypse.
Yes, please. And thank you. Also, something that I've seen be kind of impacted by this just because of our call load that we've been getting in. Also, friends that I've been in contact with. Mental health as well. Not only just physical health and eating healthy and taking care of yourself, but mental health. Being shut into your home for the next 2 to 3 weeks, as you've already been shut in for the last week, hopefully, it's a little taxing. The self-isolating is a little hard. We've all heard of cabin fever. We've all seen The Shining. If you haven't,
you should.
You should.
You might have some time. So either read the book, watch the movie, or both. Also, if you do, email us and let us know what you think.
Yes. I think we would both really enjoy that, actually.
Yes.
I love The Shining.
I don't know if I feel like I've seen it.
Oh, no.
but it's been a long time.
I like how you're telling everybody to go do this and you haven't even done it.
I guess
so
I'll be
disappointed.
I'll be the first one to email and be like, I did it.
Right. I can't talk to you anymore.
You can't?
Nope.
Well, that's not good because I'm here for a little bit.
So mental health, I'm gonna provide for you guys some phone numbers. I'll also put these in the link. There's gonna be just a whole bunch of links in the description for this episode. Locally, we have Summit Stone. What's it called?
Yeah, Summit Stone.
Is it just Summit Stone?
I think so.
We call it Summit Stone.
Is it Summit Stone Mental Health?
Something like that.
Maybe Summit Stone.
Yeah. So there's locally we have Summit Stone that's available for people if you are in an emergency situation and you feel like you are just not good mentally. They have a 24-hour number, which is 970-494-4200. There is also the National Suicide Prevention Lifeline, which is a fabulous resource, especially if you know of a friend that's not in the Loveland area that is suffering from mental issues and thinking about suicide. That phone number is 800-273-8255, or you can always call 911 in an emergency situation.
We're here to talk to.
We are here to talk to. We are here to help. We are all trained in critical situations like that. Our officers are trained for critical situations like that. So keep that in mind. Just because we're sending a police officer to your door because you are feeling suicidal or you're having mental issues doesn't mean that they're going to hurt you.
No.
As long as you don't have weapons, as long as you are not threatening them, they won't have any reason to harm you.
Yeah.
They're just there to listen and to talk like we are.
Exactly.
If you do have weapons and if you do threaten them, it's going to be a little bit of a different situation, but just think about levels of what's going on there.
Yes.
So they've got to protect themselves too in situations.
Yep. I have one more resource.
I love
it. A crisis text line.
Oh, yeah.
So if you need to, it's super simple, 741-741. That's it. And they, I was looking at their website yesterday, and they have a thing, like they have a drop down, like what do you need to talk about? They had a list of all kinds of things. The coronavirus, anxiety, suicide.
That's awesome.
Like on it, like, so you don't even have to, if you just want to talk to someone, just to chat with them, text them right away and they'll talk to you. You can do it online too, I think. So if you Google crisis text line, the whole website comes up. But you can use that. I think it's neat because sometimes I'm an anxious person anyway. So so to just be able to talk to someone, if I felt like it, is a really cool resource. Just whatever you're feeling, if you just need some mental health check-in with someone, text them. Yeah. I mean, I have the Canada and the UK one, but
for our Canada and UK listeners, I know you're out there. You might not know it yet, but I know it.
You're there.
Yeah. Erica's also got a phone number for you.
Yeah. I really like how they have the numbers set up because Canada's, maybe this is why I wrote it down, is 686868.
Okay.
Yep. And then the UK's is 85258. So the same backwards and forwards.
Oh, that's really cool.
So if you can't remember it, or if you can't remember it, then you should look it up. But if you do remember it, it's super simple.
Right. So, yeah, and I also just want to say, because of everything going on right now, we are seeing an increase in phone calls. We are seeing an increase in types of phone calls that we're getting in, like more extreme phone calls, I would say, that we're used to getting, just not as often. So, per our first episode, did we say this in the first? I don't think so. I think it's per the second episode. We explained why we put calls on hold. We might be doing that a little bit more often lately.
We're busy.
We're busy up here. And especially if we go to our emergency schedule, if a lot of us get sick, we're going to be a little understaffed. So please be patient with us.
Yes.
That's all I'm going to say. Do you have anything you want to add?
No.
No?
Mm.
Okay.
Okay, yes, I do.
Okay.
If you read something good during your quarantine time, email us. Let us know what you think about it.
Yes.
Email us your questions. I know you're going to bring this up again, but I'm super excited for the email.
I'm so excited for the email.
Talk to us.
Yes.
Let's hear it.
Yes. Please, be nice.
Yeah.
Don't call me out for saying, I'm trying to fix it. I know. I get it. I get it. I'm as annoyed as you are because I have to listen to it probably 600 times more as I edit it. But phone, books. Tell us about books. That's exciting.
Yeah.
Tell us about Tell us about the Netflix shows that you're seeing.
Yeah.
What you're doing during this crisis to keep yourselves occupied, keep yourselves busy.
Yeah.
I'm sure we would love to get ideas because when I'm not working, my usual life is basically staying at home.
Mine too. And reading.
So we need new ideas.
Yep.
Guys.
Let's hear them.
I just want to say and reiterate one more time, just take care of yourselves physically and mentally, as well as your friends and family as much as you can. Check in with them. This is definitely a time where you should be reaching out to somebody that means a lot to you, because you don't know what anyone's going through right now.
That's so true.
Besides yourself and whoever you've talked to. Anyways, that's it.
Yes. And a thank you to everyone that is working right now.
Yes. No, go ahead.
I was going to say everyone that's out on the streets and we don't know where they're going, and people in the grocery store and firefighters, EMS, our 911 partners,
our police officers.
Nurses. Oh, yeah, those guys too.
I guess those guys.
Doctors, sanitation people, everyone.
Yeah, vets, grocery workers. Did you already say that?
I think so, but say it again because they're busy.
You got restaurant workers that are still...
Delivery drivers.
Yeah.
If I forgot you, I'm sorry, because sometimes we don't get thanked, so it sucks. And if I forgot you, email me.
Just Erica, though. Just say to Erica.
Sami remembered. I forgot.
But really, truly, if you are working through all of this, thank you.
Yes.
Thank you so much for going out there and keeping this world going, because we're doing the same thing. You know, we're all in this together. And that's all.
That's it.
I just like to piggyback on what Erica says. Thanks for listening. This might be an extra long bonus episode. I might get it down to regular time. We'll see. Don't forget to subscribe to get the latest on the episodes, because the next one's going to be on the 15th, especially since like we said in the beginning, the COVID-19 could change at any time, and we want to keep you guys as updated as possible as to what's going on with us and with the city, so you can figure that out, or you can just go to the City of Loveland website, like I said. Also, like us and follow us on Facebook at Loveland Emergency Communications Center. Keep an eye out for possibly an Instagram. It's probably going to be as close to How To 911 username as possible. Next time, we will... I don't know why I wrote it like that. That's weird. I'm trying to read from a script, and it obviously doesn't work out very well. We've covered it a lot. We've already recorded this episode, so it's kind of awkward to, like, introduce it. It's really weird. The next episode you will listen to... God, I'm so annoyed with myself right now.
You're doing good.
We just said this in the last episode, but we're going to reiterate it. The last episode meaning the first.
Yes.
What do 911 operators do? It's a very important episode. We have touched on it a million times in this bonus episode, so you gotta listen.
Yeah, now you have to listen.
You're obligated.
Because you're curious.
Yeah, aren't you?
You're gonna listen.
Oh, curious. So, that's it?
Mm-hmm.
Cool.
Yeah.
Until then, know where you are.
Yep.
Know your phone number. And tell us exactly what happened.